Tune in to NCN on Thursdays at 7 p.m. and the VOG on Fridays at 11 a.m. for the Ministry of Health's weekly program, Health Matters. This program seeks to educate you, the general public, on proper health-seeking behaviors while making you aware of the services available at the hospitals and various health facilities across the 10 administrative regions. You don't want to miss this. Tune in on Thursdays and Fridays. Be educated, be informed, because your health matters. Hello there, and welcome to another edition of Health Matters, a presentation by the Ministry of Health. Our program today will be talking about diabetes, and I've got with me Dr. Lakshmi Lal. She's the Director of Non-Communicable Diseases. We also have Dr. Davina Ramsing. She's part of the Chronic Disease Unit, and from the Miss Glennis Beaton, President of the Guyana Diabetes Association. And my name is Nazim Hussain. Once again, welcome. Let me start with Dr. Lal. Dr. Lal, it's 537 million people around the world with diabetes. That's about 8%. And you were telling me earlier on, we should be looking like between 11 and 16% of prevalence in Guyana. Is it concerning?
It is concerning, and that number is rising rapidly. And so we do, at the national level, we do need to put systems in place to increase our sensitization and to increase or in our systems the availability of medications to get that under control.
Sensitization, how will we plan to do that?
So from a national level and going down to a decentralized through the regions to educate our healthcare workers, starting from the lowest level of the CHWs coming up to the physicians, to have more conversations with their patients, to go out into the villages and to hold talks, to bring the population to a level where they understand what this disease is, they understand how to manage themselves, and not just depend on what their interactions with the physician is at a clinic visit, but for them to understand what my blood sugar might be like in the morning, how much insulin I should be able to take, how I'm able to portion my food throughout the day to keep a normal level of blood glucose and to have better control.
So that's one of the main reasons for our program here at Health Matters, is to tell our viewers, sensitize them on the issues that are, educating and sensitizing. So even using the media is part of sending the message of various diseases in Guyana. We take a break, and when we come back, we will find out more about diabetes. Welcome back to our program. Oh, Dr. Lal did indicate about educating people across Guyana, and we'll have that session right now. And I'll ask Dr. Davina Ramsing, just for the benefit of our audience, and especially those who we want to target. Tell us a bit about what is diabetes.
All right. So greetings, everyone. So diabetes is a chronic disease. It has no cure, and it affects our body converts food into energy. And it's just simply saying that foods that we eat, any food that we eat is broken down into glucose, or as we know, it's sugars. And that sugar is passed to the bloodstream. Now our body has a hormone called insulin that's produced by the pancreas, and that hormone helps to move the sugar from the bodies to the cell, and that's how our body uses it up to get energy. There are different types of diabetes. We have type 1 diabetes, which is often seen in children and adolescents. And here is where the body does not produce any amount of insulin, so they become insulin dependent. Type 2 is where we acquire this, or it happens in older age adults, right, above 45 years. And these are persons who have gotten this type 2 from your lifestyle, having a bad eating habit. Right? We have gestational diabetes, which occurs during pregnancy, and it can affect the child as well. And we have pre-diabetes, This is persons having high glucose level, but it's not high enough to diagnose them. It's the stage before becoming type 2. Persons who are at risk of having diabetes are persons who have family history, persons who are overweight, persons who are aging, persons who are pregnant, or persons who are inactive, physically inactive. And these are things that they are basic things that persons out there or persons who are living with diabetes can correct. I mean, genetically, you can correct that, right? That passed on as a history. But we can start preventing ourselves from becoming complicated.
How do we go about prevention? And that's the word, prevention, prevention, prevention. I'll start with Dr. Lal, prevention, and then I'll bring in Ms. Beaton also, because I think her organization, herself, must be a strong advocate for prevention. Prevention, Dr. Lal.
So, for those persons who are non-diabetic, it's firstly to be aware if there is a family history of diabetes, either on the side of your father or on the side of your mother. If you are, if you're overweight, if your lifestyle is sedentary, if you sit in an office all day and there's very minimal
Movement.
exercise or movement. It's to correct those habits. Ensure no one's saying that you have to go to gym and have a 4 to 5 hour workout routine, but simply 30 minutes of walking. 30 minutes of walking, either if you choose to do that on a treadmill or you just simply walk in your street, or if you want to go to the park. It's watching what we eat. Of course, there's always that talk of having lots of vegetables in the diet, limiting the amount of canned and tinned products that we're consuming, and of course, the sugary beverages. Opting out for the more natural options, fruit juice, and if you're going to prepare the fruit juice, to not to add additional sugar to the drink. You have other ways of, well, like we touched on exercise before, getting that 30 minutes of exercise. And also there are those persons who may have underlying conditions, polycystic ovarian disease. We've now seen in studies that PCOS automatically increases your chance of becoming diabetic and developing heart issues later on. So it's recognizing if you do have those those diseases and getting control of those diseases.
Ms. Beaton, you've been on the battlefield for a long time. What has happened in the grounds, and what are some of the prevention methods and measures you are asking your people to put in place?
Well, what we do, thanks for having me, first of all. What we do is take the doctor's language and put it simple for persons out there. So, like Dr. Singra explained, what is diabetes? We will tell you how diabetes works. We will explain to the audience or our membership the pancreas produces a key that we take to the cell and open the door for the sugar. So it relates to the simplest person. If you don't have that key to open that cell for the sugar to go in, then we are in problem. The sugar lingering outside, creating problems. We will take the simplest education out there for persons living with diabetes. Understand that if you know where your blood sugar is at, you're better able to control it. You might not have the money to buy the vegetables when they're extremely high. So it means you go for the cheapest vegetable and you eat much. We want you to understand that your body weight matters in your carbs and calorie intake. So we will explain to a person, if your daily calorie consumption is 1600, then half of that calorie belongs to carbohydrates. You divide it by 60, and it tells you how much carbs per day. So maybe you can only take 12 carbs per day. What is one carb? A slice of bread, not the bread from the country. A pot spoon of rice, not the Chinese pot spoon. So persons kind of it it goes to their psyche and they understand it. It's really understanding diabetes that helps persons to control. We have a tool we call the diabetes education map, and that breaks it down simple. How do I use my medication? Doctor says 3 times per day. I don't do it morning, midday, and night because it can overlap. You could either run into a low sugar and you decide, well, the doctor know what he doing. He got me sugar running low, but it means you did not take your medication correct. 3 times per day is every 8 hours. Because we know those are some of the simple hindrance. People tend to blame doctors quickly when something isn't working, but they haven't done it right. You have to take insulin 15 minutes before breakfast. It means that insulin is going to start acting it within 15 minutes. And if you decide you take your insulin, oh, let me go and put on the rice. I didn't bake the roti. That time is going, your blood sugar run low, and the patient will not adhere after then. So we have to take the doctor's language and break it simple. It means that we will work with chronic disease to help to educate the smallest man to carry that message out. You break the message in chunks.
Dr. Lal, you were saying in a conversation of, before we came on set, that there are lots of people out there who don't know that they might be diabetic or pre-diabetic. What are some of those telltale signs that we need to look at for those of us who are clueless?
Right. So generally, we tell all patients, diabetic patients, there are about 5 signs you can look for: an increase in thirst, an increase in appetite. The patient may be losing weight. You might find they start to have what we call patients will develop itching in the skin, and after a while, patients get very tired. And so those are some of the symptoms you find. Also, a patient who urinates frequently. You find yourself going to the washroom more than normal, 5-6 times per day to urinate. So those are some of the very basic signs to look for. An increase in
Is it a
urination.
combination of all, or can it be just some?
So not all of the symptoms will present at first. You may have 3 of those symptoms. And more than likely, you'll find a patient will come to you that, doctor, I'm just tired all the time. I feel tired all the time. I'm exhausted. And once you explore what their activities are, you don't find any kind of reason for them to be feeling this exhaustion all the time. Patients will tell you that, doctor, I've just noticed that I'm just going to the washroom frequently, 5-6 times per day, and my water intake is not that much, but I'm going to the washroom. And they tell you that I'm just hungry all the time.
Mm-hmm. Treatment and care. We bring in the other doctor here, Dr. Ramsey.
All right. When it comes to treatment, we're going to talk about not medicating for now, right? Because most patients, when you diagnose a patient, like Dr. Lal was saying, you look for the symptoms. Now, patients don't like to hear when they're being diagnosed. We have to walk them through that process before we get to the part where you say, you have to use this medication. And getting a patient to be adherent and not compliant is better. All right. Oftentimes we try to badger the patient in, you have to do this and you have to do that. And like we had a conversation before saying, we have to avoid saying don't. All right. We have to allow them to accept what they're having first. So acceptance is a bigger thing the biggest challenge we're having with patients is accepting what they have and wanting to make that change. Right. And in treatment, it takes a lot of work. It takes a lot of dedication. It comes down with education. It comes down with, like Miss Beaton was saying in her area where she works, is that you have to make them understand what they're having so that they could apply it daily. Because this is something that you have to practice as a lifetime. So education is the key. And then with education, we could start helping that patient with, or that person there. I don't like saying patient, like that person to understand how to manage their lifestyle really, and how to portion their food, what they can eat. We always have to put ourselves in persons who are not financially able to grasp everything that's out there, because most times we have ads coming out showing us what we should eat, and it should only be this and it should only be that, and because this have so much calories. But we have to understand we're talking to persons who are living in the rural areas. They can't afford these things. So you have to explain to them what you have at home is what you can eat, but we have to learn to have them in portions. It's all about portioning and controlling yourself. And like Ms. Beaton was saying earlier in the conversation, don't ever stop them from eating what they like. There's nothing like a diabetic diet. It's just eating healthier, eating with conscience, eating with control. All right? We have to encourage them to have physical activity now. That's a very big challenge because we have persons would come and say, but doctor, I can't walk, I can't balance, I can't do physical activity. Now, I am not asking, and I'm sure Ms. Beaton, department don't ask you to do much. It's just stretches, just start something for us. Go out there and just move those muscles. You're at home, right in your bed. You just move your hands up, move your legs up, rotate those muscles for us. And eventually, as you start, 30 minutes might be seem long. It's the appropriate time for you, but we ask you to start 50 minutes or 10 minutes every day, every other day. How you're feeling, but don't let yourself become the person who's just sitting there, you give up. I can't deal with this anymore. All right? And then we advise you that you take your medication. Now, many persons, until yesterday when we had our little exhibition activity for World Diabetes Day, the first complaint the patient tell you, oh, doctor, my sugar is going to be high, but don't worry. I didn't get to take my medication because I think I'm come test my sugar and I'll go away. And that's a mentality we all have. When you go to see the doctor, oh, I'm not going to eat because I want the best result. I want doctor to see that I'm a very good patient, right? So we oftentimes forget that we have to take that medication. So I encourage them, and I'm sure many other doctors, many other healthcare personnel do the same. You encourage them, look, bring your medication with you when you come into clinic. When you finish eating your breakfast, walk with it in your bag. So when you reach your sitting waiting to see doctor, you can take your medication. You don't have to wait till you go home, because when you go home, you might not even reach home because you end up still remaining at the clinic because of a high sugar or you got into a low sugar. All right? So treatment, it's not only the medication. It's about everything else, balancing us ourselves and having that control and having the determination to want to do it. Without self-determination, we can't.
Right. We'll take a break. When we come back, we have more for you on health matters. Welcome back to our program. Dr. Lal, one of the frightening things when it comes to diabetes, and you see it popping up now and then with relatives, that people who will reach a stage whereby body parts have to be amputated. And sometimes that scary scenario is shown to people, but somehow it doesn't get the effect to everyone. Tell us how that comes about. Why is it a patient reaches a stage whereby amputation of part of a limb comes into play?
Okay, so simply the what we call the diabetic foot, or it may happen. Diabetic patients, after over a period of years from having uncontrolled blood sugars, you have nerve damage. Most times it's in the tips of the fingers and the soles of the feet and the toes. And so a patient may simply step on something. It may prick the bottom of the foot, but because of nerve damage, you can't exactly feel that there. And so if you're not examining your feet regularly, you may not know that it's there, and it's sitting there for a while. Eventually, it starts an infection. And because in those patients who have uncontrolled blood sugar, that infection will spread quickly. And so you end up having, from a very small little prick in a toe somewhere, eventually you have to amputate a whole half of the foot. Or it may come higher, sometimes even as high up as the knee or above the knee. And so it happens because of nerve damage and not being able to feel. And so diabetic patients have to be very careful, and not just from having from walking barefoot and having things stick you under the foot, but also having comfortable shoes with enough space, shoes that are not hard, shoes that will not expose your feet to elements, for anything to stick you or to damage any part under the foot and to cause an infection. And so that is how that comes about. And well, once the source of the infection starts, if the patient does not seek attention, and it's not the foot is not examined, and treatment isn't started, the infection, no antibiotics, and the infection, there's no regular dressing of the wound, etc., it continues to fester, and that's how it spreads, and eventually it gets to the point where the patient has to have the foot amputated.
Well, we're in a pandemic, and there's so many things being twisted and tossed around. Ms. Beaton, you're hearing people, so they're not going to take their vaccine because they're diabetic, or I have this and I have that, and so forth. What's been happening on the ground and feedback you've been getting?
Well, for our membership, we had quite a number of senior citizens not wanting to take the vaccine because they're diabetic, and they became Google doctors and WhatsApp doctors. And we had to hold a session on education to educate them that when they look at the statistics, diabetics were the leading death in COVID. And you have to tell them it blunt. You either take your vaccine and stand a chance, or you go out there and you're closer to death. We explain to them, like insulin or metformin that you're using, it's required for your health. You just don't go and expose. I said, because once you're exposed and you get COVID, you're not likely to come back. Your blood sugar out of control already, we have problem. And that has been working. We did lose some members that did not. And so it gave the rest a little jolt to, well, you have to. And they started coming on board. They started talking with us some more. Even the type 1s. We had several discussions with the parents, and they went ahead because it was dangerous.
Wrap up soon. Time is going. How can people out there who are now being diagnosed, how can they get onto your organization?
We are located at 106 Crowell Street, opposite Ministry of Foreign Affairs. The number there is 223-3756. And even though it's not a diabetes center, it's my professional office. I've trained some of my staff to take care of them. They can become members, they can have insulin, they can have glucometers, they can have strips. But when it comes to the medication, your doctor have to prescribe that insulin for you.
Dr. Lal, back to the vaccine. How safe is all the vaccines here in Guyana as it relates to persons with diabetes?
So we want to encourage our population, any patient, not just diabetics, patients who are having heart disease, to go out and to get your vaccine. There's no contraindication to say that there is a specific vaccine that you cannot have because you're suffering from a disease. And more so because you are a diabetic patient, we're encouraging you to get the vaccine, to give yourself a chance to acquire that immunity, so that if you are infected with the virus, you give yourself a fighting chance to fight off that infection.
Thank you very much for being on our program. That's all the time we've got on Health Matters today. Do join us again for another edition of Health Matters. My name is Nazim Hussein from the Ministry of Health.